Hi everyone, Dr. Amy Abelar with Acupuncture Practice Systems, and this is another video in our series on the intersection of motherhood and entrepreneurship. In this video, we're going to be talking about the return to work after maternity leave, and I'm going to give you a few different tips. We're going to talk about some things that you're going to want to consider, and without further ado, let's get started. So, number one thing that you want to consider is how much time you're going to have when you do return from maternity leave. Some people are returning part-time, where you may only be in the office 2 days a week or 1 day a week and home with baby on the other days. Some people are going to return to work 5 days a week and put their kid in daycare full-time. So lots of different options, but you'll want to think ahead about how much time you're going to want to have when you do return from maternity leave, and know that inevitably, no matter how many days a week you're returning, you're probably going to need a little bit more time with your regulars when you first come back, because some people are going to want to know, how's the baby? How are you feeling? Some patients you may be close enough with that they're going to want to see pictures of the new baby, and that's all going to take time. So if you normally run your schedule in a way where you're pretty like back to back to back, you get in, you have a few minutes, you catch up for, just a few minutes with patients. What do they want to focus on? They get on the table, you put their needles in, you leave. When you first get back from maternity leave, if you have any kind of established relationship with your patients, they're probably going to want to do a little bit more talking. Or they're going to have more things that are going on because you've taken 6 weeks off, 8 weeks off, 10 weeks off, however long. And so when you do first come back, it may be that they have more things that they want to share about new things that are going on with their bodies. They may need more areas of focus. They may ask the questions about you and your maternity leave and how all of that went. So just to keep in mind that when you do first come back, you may want to add some extra little blocks in your schedule so that you don't book patients quite as close back to back, because I did do that when I first came back. I booked patients back to back closer because I didn't have a lot of treatment time available. And so I thought, okay, I just need to focus. I just need to squeeze. I need to make sure that I keep the chit chat minimal, which is not normally my style. And so I need to be able to do that so that I can be getting on to the next patient and the next patient, because I don't have that many hours. When I first came back with my second, which is the most recent, I only had 1 day that I came in for a chunk of like 4 to 5 hours to treat follow-up patients, and that was pretty much it. So I thought, because I didn't have, which is another factor, right? I didn't have a lot of childcare available, which means I didn't have a lot of time on my schedule. So I came in and I just wanted to try to squeeze as many patients as I could in that shorter period of time. And I had the rooms to allow me to do that. So I did. But again, first time when you're first seeing those patients, it doesn't mean that you have to do this forever, but when you are first seeing patients, you may want to leave a little bit more time in between, especially that first one back. And then once they've been back to see you already, you've kind of caught up on things in their life, their aches and pains, new issues that they may be dealing with, and you've shown them a picture of the baby if you feel comfortable doing that. Then after that, you should be able to kind of get back into your normal pace. But at first, when you first come back for those first few weeks and you're seeing people again, I'd highly recommend adding some extra breaks in your schedule for that. Another thing that you're going to want to consider is, are you breastfeeding? Are you pumping? If you are somebody who is breastfeeding and or pumping, then you need to make sure you leave time for pump breaks. It is going to be extremely uncomfortable if you don't have enough time allotted in your schedule for pump breaks, because obviously you're going to get engorged, things are going to be physically uncomfortable, and then that can also affect your supply. So you can strategize. Like if I came back for just that 4 to 5 hour chunk, I saw patients for a couple of hours. I had a break in the middle where I had enough time to pump, and then I saw patients for another couple of hours before I went home. And I made sure I pumped right before I went to work and right after I got back. So that way you can make sure you maintain your supply. So if you are going to be pumping, you do want to make sure that you budget time for that. The thing that makes that hard is you do not want to have a patient on the table while you are in the middle of pumping. Let's say you can pump in 20 minutes and you get a patient on the table and that patient's on the table for 25 minutes or 30 minutes. You don't want to count on that, because what if that patient buzzes you, right? I should say I wouldn't recommend counting on that being your pump time while you have a patient on the table, because you never know when they're going to get too warm, too cold, need something adjusted. And if you've already gotten in the middle of pumping, that's not something you're going to want to pause. So I would highly recommend you have that time be a time where you've got it blocked. Now, I'm a little bit crazy in my overlapping of time management. And so one of the things that I would do is I would have a big chunk of time that was blocked where I would book my patients back to back to back more quickly. And then during that blocked time, I would make sure there were no patients on the table. I would get my pump set up. I would warm up my lunch, and I would literally eat and chart while I was pumping, so that I could get all of that done at the same time. So triple tasking like that is not going to be everyone's cup of tea, but if you are limited on time that you are away from the house and in the office treating patients, that is one way that you can help allow yourself more of a pump break. The other thing to consider with pump breaks is, let's say you're somebody who would have had to pump again at a certain time period. Maybe that means if you've got to add like another hour block on your schedule, so you have no patients on the table and then enough time to pump, and then you're going to just work another hour, maybe you don't do that. Maybe you just cut that last hour of work, because now that's 2 hours longer that you're at the office just for that one extra hour of work. And maybe that's not worth it. Maybe you'd rather go home, spend that time with your baby, not pay for childcare during that time frame. So plan it out with ideally pumping at home before you come in, scheduling out your pump breaks for however often you need them. And if you are working for somebody else, legally, you are entitled to pump breaks. Do not let them tell you that you're legally entitled to pump breaks. So whether you're self-employed and you can put this time in for yourself, or you're working for somebody else, that is a protected time. So make sure you take it. And if it is your protected time and you're not a self-employed entrepreneur like me who's trying to just multitask everything as much as I can, your pump break can be separate from your lunch, can be separate from your charting time, right? If you're a W-2 employee of somebody else, you should not be charting during your lunch. You should not be pumping during your lunch. Your pump break should be a separate time. Well, your pump breaks are protected, but they're not paid. So if you want to overlap your pump and your lunch, you can do that. But if you don't want to, you also don't have to. So that's at least the law where I am. Check your state laws to see what you're entitled to for where you are. But just make sure that you do budget in that time for pump breaks when you come back. And know that, that may have to change, right? As your supply increases or decreases, or things going on with baby, you may have to change that. So something to consider so far that we've covered with coming back from maternity leave is, how much time are you going to have, allotting pump breaks if you need pump breaks, and then making sure that you're budgeting a little bit of extra time in between patients to start with, because they may want to talk about more issues going on with them, or to ask about the baby and maybe see a picture. So just make sure you're budgeting for that. And then the other thing too is this can be a strategy for when you decide how many rooms you're gonna run, if you have the capacity to change the amount of rooms that you're using. So one of the things that I did was, for a long time, I really only used 2 rooms. I enjoyed running 2 rooms. It allowed me time to do other admin tasks while I had a patient on the table. It allowed me to do a thorough charting while my patient was on the table, and I ran 2 rooms for a really long time. I didn't start running 3 rooms until after I had my second. And again, that was because I didn't have a lot of childcare available. And so when I was here, that meant that I had to cram in as many patients as quickly as possible. And so once I was done with pumping and that part of our journey had ended, I was able to just come in and basically bring snack type foods for myself and just back to back to back to back for that chunk of 4 or 5 hours. And then when I switched to doing 1.5 days a week, I would just go back to back for the half day. And then I had a lunch in the middle of my full day for my full day that I was working. So I ended up switching from running 2 rooms to 3 rooms at that point in time because I had patients that I was trying to treat and I only had so many days that I could fit them into. So because of that, I had to run more rooms if my timing was limited because I need to be able to squeeze in, higher capacity in the same amount of time. So 4 rooms is definitely never going to be a thing for me. I don't think I could confidently do that and keep the same quality of my sessions, but 3 rooms was my max. So I went from 2 rooms to 3 rooms. What that meant is during the time that I am in here treating patients, I am literally just treating patients and I'm charting as best as I can. At the end of my day, sometimes I have a few charts that I didn't get to, and I'll do those at home after kids go to bed. But for the most part, I'll just treat patients and I'll chart, and that's kind of all that I can manage while I'm here. Maybe I have a patient that needs labs ordered. Maybe I need to do research on herbs for a patient. Maybe I need to send them a full script link with a couple of supplements that I recommend that they take because they got their labs back. Maybe I need to do research on a new patient that I have coming in next week that's got, is being treated for something that I haven't treated recently, or, whatever the case may be. You have a complicated fertility patient. You have, somebody asked you for a referral to a chiropractor you recommend. You don't have their cards. Maybe you need to email that to them later if you don't have a receptionist to do it. And so my point is, all of these are all things that can be done at home. Now, this can feel super disjointed if you are used to being in the office for a certain period of time and just running through your day and getting all of the admin and back end and herb research and supplement research and emailing patients links to things. You may be used to being able to do all of that while you're in the office. But when you return from maternity leave, if you are limited on your time and you're not coming back full time, then these are the types of things that you can wait and do later so that you can just come into the office, treat your patients, and then go back home. If you have a young baby at home, they are going to be taking naps, and during those nap times is when I would get some of this other stuff done. So I would let patients know when they can expect it from me. So like I can say I'm back to back with patients today, but I can email that to you within the next couple of days. And I put it on my to-do list. And then over the next couple of days, when I've got gaps in my day where a baby is sleeping, then I can hop on and, send them the full script email or order the labs for them or whatever else it is. So I just want to make sure that I point that out, that is one way that feels disjointed, but is a way that you can accomplish treating more patients during the time you have childcare, and then saving those other types of tasks for times that you're at home for times that you're at home while your baby is napping, so that you're able to kind of salvage your time as much as you possibly can and still accomplish all the things that you want to accomplish for your patients, because there are some things you can do at home. Now, obviously, if you're a W-2 employee, that's not going to be the same. You're not going to be able to do it that way. But if you're self-employed, then, that's a solution. And most of you that are watching this are probably self-employed. So, but I just got to throw that out there. And again, something to just remember is that it's not going to be this disjointed forever, unless you do plan to only be back part-time for, the foreseeable future. But during the time that you're coming back part-time, these are some of the strategies and some of the things to consider when you're trying to return from maternity leave, so that you can be present for your patients, you can have as much time allotted for your patients as possible, and also spend time at home bonding with your baby, because obviously that is a super big important piece of being postpartum as well. So remember to respect your body, remember to listen to your body's limitations, and remember to set aside time for what you need, like your pump breaks, your lunches, and that can be something that changes over the course of time as well. when you first come back versus when you're 6 months postpartum versus a year or a year or 2 years postpartum. Your schedule could be looking different at different stages. And just know that this is a time where a lot of flexibility is going to be needed. Speaking of flexibility, I'll just add this in real quick before we finish, that something to kind of consider or plan ahead for is who is going to take a day off when kids are getting sick. One of the things that I think is super important is, my husband has a W-2 job. I have patients. If I was only going in to treat patients 1 to 2 days a week and he works Monday through Friday, what we tried to do is we tried to schedule my days a week that I went in to be days that were not super meeting heavy days for my husband, so that if for some reason baby was sick or our other son was sick and needed to be home from school, I was not going to have to cancel 15 patients because that would be a huge pain in the butt. I was not going to have to cancel 15 patients that my husband would take PTO. So it was like, okay, if kids get sick and one of us has to take a day off, I'm the one who's at home, I'm home 5 days a week, weekend plus the other 3 weekdays. And, obviously my husband and I are sharing weekend duty, but, Monday, Tuesday, Wednesday, let's say, are days that I'm at home anyways. Thursday, Friday may be the days that I go in to treat patients. So Thursday, Fridays would be days that if we have a sick kid and someone has to take time off, my husband's the one who's taking PTO so that I don't have to cancel 15 patients. And then if it's a sick kid on other days, then I'm the one who's now dealing, double duty with kids, or I'm canceling whatever other personal appointments that I have. And so that was kind of a strategy that we took ahead of time, so that it wasn't like arguing over whose day is more important, who has more things going on. So we tried to strategize that for when I was returning postpartum. And that worked out really well for when our kids were first starting daycare too, because I didn't immediately go into treating patients 4 or 5 days a week once our kids started school, and continue to just treat patients a few days a week so that I could focus on other things like the acupuncture practice systems membership on the other days. And so we kind of continue to keep that same rule of, if kids are sick and one of us needs to stay home, we have certain days that, unless for some reason my husband gets some crazy major meeting that he absolutely cannot move, in which case he'll usually take a partial day. And so I don't have to cancel 100% of my patients and get them rescheduled. But just another tip for trying to help with pre-planning for the things that will happen that are not planned during your postpartum period. This is just one video in our series of the intersection of motherhood and entrepreneurship. So feel free to check out our other videos in the series or any other videos on our channel that you might like.